In the headlines, the Ministry of Education to keep schools under scrutiny to ensure safety protocols are strictly followed. Top medical officials warn those who frown on quarantine to understand its role in Dominica's mitigation efforts against COVID-19. And a project geared at building resilience around land use to benefit farmers of Petit Soufriere and neighboring communities. I'm Andrea Louis with the Channel 5 News, back with the details after this.
We are strong, we are resilient, and we will get through this together. But these are stressful times, and it's important to also practice good self-care. It's normal to feel overwhelmed, anxious, or afraid, but there is hope. Reach out to someone, connect with your friends, stay in touch with your community, and know that you are not alone. We're in this together. This is a public service announcement from the Dominica Red Cross.
Flow helps you stay connected to what matters. Simple plans and a better network mean that you can enjoy 7 days of unlimited social messaging, 3 gigabytes of reliable data to use as you like, 700 local anywhere calls and texts, with the always-on prepaid plan, all for $29. Keep your number when you switch to Dominica's most reliable LTE network. Buy wherever you top up. Switch to Flow. It only gets better.
Thank you for staying with us. First up, quarantine has become a bad word for those who resent the inconvenience and refuse to adhere to COVID-19 protocols. But a top health official here says it is a key component of Dominica's success so far in mitigating the impact of the pandemic.
COVID-19 is a public health emergency of international concern. As the outbreak continues to evolve, we must all consider options to prevent continued introduction of the disease to our country, and we must do whatever we can to reduce human-to-human transmission in places where the virus is currently circulating and in our country, Dominica. One of the public health measures used to achieve this goal involves what is known as quarantine. This entails the strict restriction of movement or the separation from the rest of the population of healthy persons who may have been exposed to the virus, with the objective of monitoring their symptoms and ensuring early detection of potential cases. Isolation, on the other hand, is the separation of ill or infected persons from others to prevent the spread of infection or contamination. When one is quarantined, it does not mean that the individual is sick or ill. It simply indicates that possibly that individual has been exposed to disease, and as a result, that individual must be secured away from the general public and monitored closely for the development of symptoms of the disease. Quarantine, when executed properly, prevents the individual, who is a possible source of infection, from spreading the infection. It also protects you and me, who are supposedly free of infection, from contracting the disease. There are several research articles that support the effective use of quarantine measures to help prevent the spread of disease, and in this case, the dreaded COVID-19.
Dr. Tong says while quarantine may be looked upon as a nuisance, its benefits far outweigh the inconvenience. She is appealing to all those who may have to be quarantined to understand the reason for the measure.
We recognize that one of the concerns of travelers is the wait time to be processed and transferred to the quarantine facility. I wish to extend our sincerest apologies for this inconvenience. However, please note that oftentimes the actual number of travelers arriving on island may exceed the expected number. This can occur, for instance, if travelers upload their online questionnaire or their PCR results at the last minute. These travelers are then granted the ability to board, thus resulting in the increased number of actual arriving passengers and ultimate delay in processing and transfer to the government quarantine facility. Now, following a period of quarantine, individuals are sent home, but with continued monitoring by healthcare providers.
In other top stories, Dominica joins other countries in the Caribbean to use creative means to spread the message of disability.
This is the aim of a UNICEF-funded project using broadcast media to create specific programs which will reach a wider audience in the region to inform Caribbean citizens on the disabled community. Executive Director of the Achievement Learning Center, Beverly LeBlanc, says Dominica is looking forward to working with other countries in the region to spread the message about the disabled community.
We had just received we just received funding from UNICEF, and we'll be having we'll be launching our 5-part series podcast called Acceptance, Imagine It's You, and basically Caribbean voices in response to COVID. So it's not just going to be, although Dominica get the lead on the project because we got the project, but we will also be presenting it in a way that it has a regional impact. So our guests will not be from Dominica. We have guests from Guyana, Jamaica, Trinidad. So they will be appearing on this podcast. And then we also have an animated series that we are going to use. And actually, we are going to create it using some of the students from the school, their favorite characters. So it will have a better impact and they'll remember the messages better.
LeBlanc is appealing to Dominicans to broaden their knowledge on the situations which affect the disabled community and create a more inclusive society.
Read up a little bit more on the challenges and the issues of persons with disabilities. And you can broaden your knowledge, because a lot of times when people think of disabilities, they only think of somebody who's probably on a wheelchair or somebody who has Down syndrome. You have visible disabilities and you have invisible disabilities. And then people with disabilities are people first. And that's why we use the people first language. We don't describe somebody based on their disabilities. And then find out from the people, rather than, if you do not know, find out. Ask questions. Don't just look at somebody with a disability and judge. Stop the discrimination, stop the marginalization, and let's commit ourselves to build inclusive communities, because inclusion is in everyone's ability.
In other stories, the Ministry of Education says it will provide continuous supervision, monitoring, and assessments of the implementation of COVID-19 protocols. There will be continuous site visits to educational institutions and inspection of premises by environmental health officers to ensure the proper implementation of safety protocols.
Frequent cleaning and disinfection activities will continue. We are encouraging students to use the waste management, follow waste management practices at the school. When disposing of disposable masks, do not dispose of them anywhere. Use the bins provided around the school. We are emphasizing frequent hand washing. And we are encouraging classes, we are encouraging teachers to provide time within the day, time within periods, to allow for students to wash their hands. Even if we have hand sanitizers, hand washing is encouraged. And we are in the process of installing facilities for hand washing where limited numbers exist at the schools.
The Ministry of Education wants to ensure the public education campaign is maintained for the benefit of the school population.
We are also encouraging that posters be displayed on the behaviors expected at school. We have produced some 5,000 posters on hand washing, posters on how to wear your mask, different types of posters. And we expect that all of these will be displayed all around the school. We are also expecting that all manipulatives should be sanitized before use and after use, and during use too as well. Manipulatives, especially for the early childhood sector. We are expecting them to play with toys and other manipulatives that are available in the early childhood sector, in the early childhood facilities, in daycares. They should be frequently sanitized. Teachers preparing posters, those should be frequently sanitized. If you are preparing charts, we encourage those to be laminated so that they can be frequently sanitized.
The World Health Organization has provided some guidance on what plans should be in place in the event a student gets sick from COVID-19 while at school. With students around the world heading back to school, questions have been posed to a WHO panel on what procedures need to be in place to handle cases of COVID-19 in schools.
It's really important that when schools are considering opening up and we have the safe resumption of schools, is that there are plans in place specifically to address an example of what you just asked in your question. What are the plans in place if you have children that are ill, if you have children who have respiratory illness or have fever or are suspected to have COVID-19 or something else? Is there a plan in place within the school itself to say this is a case that we're concerned about or a potential case that we're concerned about, and to have how the child should be cared for? And then if that individual is a case, what is the plan around contact tracing, and what do you do in terms of if a classroom should be closed or if there should be a partial close or not? WHO, with our partners, with UNICEF and with others, we have a technical advisory group that is helping to advise us on educational institutions, specifically around these considerations. What needs to be taken into account when schools open, or how schools open, and how they can open safely. And I think one of the big things is this plan in place to be able to quickly detect a case, and then what do you do if this individual is an actual case? And those plans should be outlined very clearly. What are the actual steps that need to be done in terms of alerting the school nurse or the parents, tests that need to be done, the follow-up of contact tracing, informing of the class itself and the parents themselves. We are seeing schools that are putting into place different measures within the class itself, keeping classes in these bubbles, so to speak, so that the class itself stays together and they don't mix with other classrooms. We are seeing differences in the way that they are approaching this by age, with the youngest children having a certain type of activities that they have to do per day, making sure that they do their hand hygiene, making sure that they're well informed. Older children, making sure that they have their physical distancing and hand hygiene, and et cetera, et cetera. But it is very critical that these plans are clear, and that it's communicated not only to the staff of the schools, but the children themselves and also the parents.
You are watching the Channel 5 News. Stay tuned for more after the break.
A new in-home experience is here. All your services bundled into one simple plan. Faster, more reliable Wi-Fi so that you can binge, play, and stream uninterrupted. Unlimited flow local landline minutes mean you can talk and talk and talk. Plus the best in TV entertainment with over 120 channels and 29 in HD. All for $160 a month with the new all-in bundle. With Flow, it only gets better.
We are strong, we are resilient, and we will get through this together. But these are stressful times, and it's important to also practice good self-care. It's normal to feel overwhelmed, anxious, or afraid. But there is hope. Reach out to someone, connect with your friends, stay in touch with your community, and know that you are not alone. We're in this together. This is a public service announcement from the Dominica Red Cross.
Welcome back. Farmers in Petite-Soufrière and surrounding areas to benefit from a project focused on nature-based solutions to build resilience around soil and land use activities. The project is being spearheaded by the Inter-American Institute for Cooperation on Agriculture, ICA, in collaboration with I Am Movement of Trinidad and Tobago and the University of Florida. The $1.97 million project is expected to run for 36 months. Speaking at an introductory session on Thursday, Regional Specialist with ECA, Diana Francis, says the project will help farmers plant back better.
Through this project, we want to promote and support efforts, starting in one community for now, to plant back better, to save our soils, rivers, and seas, all based on what farmers are very familiar with, the good agricultural practices, or GAP, and more recently, terminology called climate smart, climate resilient agriculture. This project will reinforce what we already have been doing under those two areas, those two systems, using what is considered old knowledge as the vetiver grass and other solutions that are readily available in the Dominica's natural environment.
The project is titled Strengthening Coastal and Marine Climate Resilience through Upland and Coastal Ecosystem-Based Adaptation and Community Engagement. Francis says another objective is to have aspects of the project mainstreamed into government-approved policies.
Observation and monitoring is going to be important because this is almost, it's not new, but it's a new way of doing things that people are not really accustomed to, particularly in terms of the terminology EBA. So we're hoping that all of the lessons and the successes and the experiences that come out of this project and other similar projects that can complement what we're doing in Dominica can be now mainstreamed into policy making, into programs, into projects, and general practices in agriculture and beyond agriculture, including fisheries and other areas.
4 countries are participating in the project, namely Antigua, Dominica, St. Lucia, and Tobago. And the manager of the country's top funeral home would like to see an amalgamation of all such entities on island. Julian Morris has the details.
Lyndhurst Funeral Home recognized its 32nd anniversary earlier this year. In addition to 2 other funeral homes, they provide funeral services for Dominicans. Manager of the home, Josephine Dublin Prince, believes the funeral homes on island should come together and establish policies which would improve the standard of funeral service delivered to Dominicans.
Especially in terms of space at the grave sites and the upkeep of the grave sites. Because here we do a brilliant job. And the last end where the family would like to see clean and neat burial, we have all kinds of things happening, which is not our fault. So we'd like to probably, through policy or what, to ensure that all of those things are ironed out. Because the whole issue of funerals now, people are now seeking private burials because of the lack of space. What's the policy in relation to that? People are doing sea burials, So we have persons who actually want to cremate their bodies. So we have a number of services that people are requesting that probably together as a funeral home we can assist government in terms of its policies.
Dublin Prince believes a joint approach towards policy formation will also be useful in times of disaster.
The whole issue of COVID, that would affect us directly, because you can imagine if someone who died of COVID comes to our place, how prepared are we? Hurricane David or whatever, hurricane or disease, you may have mass burial. How can we deal with that as one funeral home? If there probably is an association, we can come together and say that in terms of the policy, you need to definitely have your refrigerations working properly, get incentives to purchase the things that you need and so on.
A cremation facility is on the cards for Lyndhurst Funeral Home as it looks to grow the cadre of services offered.
Actually, that was part of the plan of expansion of Lyndhurst Funeral Home. It is still on the cards. And there are persons who, through working here, a number of persons for one reason or the other who have flown to Barbados or St. Lucia for cremation. But people definitely would want that service. They have been requesting it really.
Flow helps you stay connected to what matters. Simple plans and a better network mean that you can enjoy 7 days of unlimited social messaging, 3 gigabytes of reliable data to use as you like, 700 local anywhere calls and texts, with the always-on prepaid plan, all for $29. Keep your number when you switch to Dominica's most reliable LTE network. Buy wherever you top up. Switch to Flow. It only gets better.
We are strong, we are resilient, and we will get through this together. But these are stressful times, and it's important to also practice good self-care. It's normal to feel overwhelmed, anxious, or afraid. But there is hope. Reach out to someone, connect with your friends, stay in touch with your community, and know that you are not alone. We're in this together. This is a public service announcement from the Dominica Red Cross.
A new in-home experience is here. All your services bundled into one simple plan. Faster, more reliable Wi-Fi so that you can binge, play, and stream uninterrupted. Unlimited Flow local landline minutes mean you can talk and talk and talk. Plus the best in TV entertainment with over 120 channels and 29 in HD, all for $160 a month with the new all-in bundle. With Flow, it only gets better.
To end the news, the headlines again. The Ministry of Education to keep schools under scrutiny to ensure strict adherence to COVID-19 guidelines. Top medical official warns those who frown on quarantine to understand its role in Dominica's mitigation efforts against COVID-19. And a project to build resilience around land use to benefit farmers of Tiditsu, Freya and neighboring communities. Feel free to access or past the newscast on our YouTube channel. On behalf of the entire production team, I'm Andrea Louis, and to all of our viewers around the world, thank you so much for watching. Join us next time.